Let me welcome all these people in.
Perfect.
Okay. All right. Hello, everyone. So we have a smaller group today, but I'm really excited to speak about this topic. So I see some familiar names here, no faces yet, but I see familiar names. So thank you guys for being here tonight. We are recording this, so whoever missed out on this presentation or whoever has to leave a little earlier, you are going to get an email with the recording so that you can view it again. And today's title is Teach Functional Skills to Help Your Child Develop Interpersonal Relationships. So this is what we're going to be speaking about. For those of you who don't know me, my name is Dr. Monica Gilbert. I am the founder of Crystal Minds New Beginning and Crystal Minds Psychological Services, where we provide ABA therapy. We also provide mental health counseling, psychoeducation evaluations, psychological evaluations, all of that great stuff. And I have my doctorate in clinical psychology, and I'm also a doctoral level BCBA and LMHC. And tonight I have one of my colleagues, who's Miguel, who just left a presentation a couple minutes ago and is actually alive here with us. And thank you so much, Miguel, for agreeing to do this, after the other presentation you had to do, and I'll let you introduce yourself.
Of course. First, thank you so much for the invitation, Monica. We've had a couple of conversations about this. We're both passionate about this topic, so gladly I will share some of my thoughts. My name is Miguel, and I have been practicing behavior analysis for about 15 years. I would say in that process, when it comes to supporting children and adults with intellectual and developmental disabilities, I have worked across many different settings in family homes, in group homes, in center-based programs, in schools, and across all ages. But maybe a common denominator for me, where I could say my niche is in assessing and treating severe problem behavior, and nowadays is teaching functional skills, and informed by a curriculum called Essential for Living, that was written by a behavior analyst to support children and adults with moderate to severe disabilities. But yeah, my background has been mostly in addressing dangerous problem behavior, severe forms of problem behavior, and crisis stabilization, and assessing and treating through skill building. So today I think that's going to be my space mostly, talking when thinking in particular about those who have more limited skills.
Mm-hmm. Okay, perfect. Well, thank you so much for that introduction. So we know who you are. And I know you have a workshop that you're going to do soon. So maybe you can tell us a little bit about it at the end. And I know we have oftentimes we have behavior analysts who come here. I already see one right there. So you can share that information, and they can can give them info on how to register and all that. So let's talk a little bit about functional skills and interpersonal skills. I wanted to define this because, that's what we do as behavior analysts, right? We define things. But also because I feel like sometimes people get it mixed up. Like, what is a functional skills, right? So functional skills, this is just the definition, but I don't know, Miguel, if you want to chime in and give me, some of your, I guess, more composed definition. But functional skills are practical skills that are essential for everyday life, education, and workplace. And then we have interpersonal skills. So this word interpersonal is used a lot in mental health, but it's being used a lot as well, all over. So interpersonal are crucial abilities and behaviors that allow individuals to interact and communicate effectively with others, right? So when we talk about those interpersonal relationships, that's what it is, right? Those friendships, those romantic relationships, like all those type of relationships. So that's what functional skills and interpersonal skills are. Miguel, do you want to add to this, or how would you define functional skills or interpersonal skills?
So the way we define functional skills in our curriculum is skills that in their absence, the person would depend on others to complete some of those activities. Skills that are required in other settings and skills that would need to be taught in those circumstances, right? In the circumstances in which they would be expected to occur, and skills that improve quality of life. And for that, for a lot of learners, children, adults, that means getting to communicate what you want and what you need to communicate. So as to get access to the things that matter to you, right? So getting more control over your circumstances, more control over your contingencies through communication. So getting access to the stuff that matters to you.
Okay, I really like that. So skills that in their absence, it would make people depend on others.
Correct.
Right? Okay, okay. And I know that we spoke a little bit about these when people say like, and I feel like, for example, when I go to my pediatrician, right? It's all about developmentally appropriate skills, right? So they compare your child to like another child that age, and then they tell you they're in the 30 percentile, they're in the 40 percentile, right? Like, what does that even mean anyways? So what is your take on, when parents use that as a point of reference, right? Like those, and therapists as well, those developmental skills.
So we've given them this information that the expectation should be for any child to catch up to typical development through an intervention. And what informed this was autism, because the studies that were done after interventions for that population suggested that some of them can and do in fact catch up to their typically developing peers and then become academic learners, academic students. But the reality is that a lot of those individuals with autism that receive intensive intervention for a number of years, they don't catch up. The gap between their skills and typical development just becomes bigger. And so it's harder to project that they will be catching up. And so the question then is, what should be our point of reference? If not trying to catch up, what would make their lives better? So then your North Star or your point of reference becomes, or what we would suggest it should become, is quality of life. All right. So what skill would make your life better? Would make you safer, or as you're suggesting, have better interpersonal relationships. So what would make your life better, the life of your family, and the life of your your contribution and participation in your community? So then the reference becomes different. It shifts towards the things that you teach that in the short term and in the long term improve quality of life.
Okay. Yeah. And that reminds me of a quote, I think it was by Einstein, that said something like, if you judge a fish by its ability to climb a tree, it will think its whole life that it's not good enough or something. It's something along those lines. But you mentioning that, it kind of reminded me of that, right? Because, we are comparing children to kind of like that norm. And then if they don't match that, which again, the norm is just because it's the average, but that doesn't mean that it's like this, I don't know, qualified norm or something. But if the child doesn't catch up, then we as parents feel bad, right? We feel like we didn't do what was important. As therapists, we feel burnt out because we keep pushing and we're frustrated and we're not getting there. And as a child, I'm sure, you don't feel very good as well.
Yeah, that happens. It is seen by a lot of parents, and understandably so, as failure.
Yeah.
But then it then requires some rethinking. Someone can have a dignified life, a life of participation, a life of contribution, one where they are healthy, right? So their health, their safety, their well-being, their inclusion within their families and their communities is there, and they're able to engage in daily living skills and communication skills, and have a close and supportive relationship with those who matter in their lives. And this can happen without ever being academic. So some people can even uh, have a job and have a fully independent life and never have gone through a formal math or science class, and it's possible. But sometimes this rethinking is hard. So with parents, you have early and frequent conversations and gentle conversations, allowing them to arrive to this notion, and for it to be something you aspire to, not something you feel that you had to, a shift that you had to make, and not one that you want to make for the quality of life of your child.
Right, right, absolutely. And we're speaking a lot about quality in life, quality of life. How would you define that? What is quality of life?
Well, I mean, it starts with tied to my definition of functional skills, right? So the outcome of those functional skills is better quality of life, in the sense that you are safe, right? You are independent, you are happy because you get to communicate your wants and needs, uh, and you are able to do things without requiring others to complete them. That to me is quality of life. One that is free also of severe problem behavior, right? Which occurs or tends to occur in the absence of important and essential skills. So to prevent that, to be free of that, then we proactively teach to those skills that will help them have an effective life, essentially,
Right,
and
right,
not to have what they call those accidents of learning that would lead
right.
to those problem behaviors to shape up and become maladaptive and interfere with their health, interfere with their integration, their inclusion, and their health, their safety, their integration, all of it.
Yeah, and I think as parents, I know a lot of parents come to these webinars. So as parents, and I'm including myself as well, because I'm a parent and I'm a human, right? I think as parents, we have to sometimes take a step back and say, am I kind of projecting my own needs of success, my own needs of whatever it is into my child? And am I pushing them, right, to that extent because I want them to succeed in that way? But it may not necessarily be something that either they're ready for, they're capable of at that time, or they even want. So I think as a parent, it's important to kind of take that step back and understand that, hey, my child is, apart from me. And that sometimes when we push for something, and we see this in a lot of movies, right? Where there's a parent that perhaps was not like a baseball player, and then they want their child, right, to be that baseball player. And we see that happen. But it's important to take that step back, and understand that sometimes it's our own, kind of void, or our own, tendencies to do that. Like, for example, I've worked with parents in the past that are pushing academics and they're pushing math. And I'm like, Mom, instead of pushing math so much, we've been doing it already for months and months, right? And it's difficult for them to understand this concept. Instead of doing that, let's take them to go buy something, right? So more of those functional academics rather than just knowing math for the sake of it, for just passing. I think that's something that's more important. What's your take on that, Miguel?
Yeah, that's a nice example when you talk about math, and what would be like a formally academic goal versus a functionally academic goal. You could rote count to 10 or to 100, but where is that gonna take you? Where is that skill going? Where are you gonna use it? But
Mhm.
if you are counting during grocery shopping, and you're asked to get quantities of things, then that counting is functional, right? And so you teach to that, and in those contexts to count, and it's a different kind of skill, that correspondence, right? When to stop, when do I stop counting, when do I have the quantity that I was asked to get? So you program for that, versus the rote counting that is not going to be useful. So is the general rule of thumb really for any skill, functional, academic, or other, is to think, where is that skill going, right? And how does it make this person's life better? And yeah, I mean, that involves sometimes pausing and thinking about, what am I teaching and why? Because we were just sometimes given some skills to teach and never question them.
Yeah.
Or there is this comparison to typical, which is okay. A lot of learners do catch up to for that to become relevant. But if that's the case, then teach it by all means. But if not, then think about, what am I teaching, where I'm sensitive to the effort it takes, right? So some skills is like climbing a mountain for some of these learners. It takes so much time and effort to teach them and for them to engage in them. And sometimes that's where we get into issues, power struggles, lack of motivation, because it doesn't really pay off and it involves too much effort, and we're being insensitive to not only the effort it takes, but the motivation and the outcomes that will yield to have to kind of engage in these skills. So if it pays off, then you're in the right track. If it makes your life a little safer, a little better, it pays off. So again, it's just about maybe rethinking a little bit, what are we teaching, and why are we teaching those skills?
Yeah, I love that question why. I remember in mental health, they used to tell us you should never say why. And I was always like, why? Why is so important? And we should always ask that. Why are we teaching these skills? And we spoke about this in last webinar about paying attention to our children's to their strengths and kind of honing on that, right? So perhaps they're not good at counting, but maybe they're good at this other thing. So let's kind of enhance or focus on those skills to make it more functional, right? And the whole functional thing is like so important, because even us, we've probably learned things in school that we're like, what's the point? Like I have this funny anecdote. My husband was telling me the other day, he's like, I don't understand why they taught us geometry and this and that. And then, we were moving things around in the house, and he had to like put the couch where it had to go. And he was completely failing that. Like he failed. And I was like, you see, that's why geometry is important. So that reminds me of that, right? That we have to look at these skills and say, okay, this is going to help them, or this, it may not be this skill, but this is going to be the skill that's going to help this skill, which then will help that other skill that's going to help this person in the long run, right? Which I know that you and I spoke about prerequisite skills, and I don't like using that term, but more of these integrative skills, right? So if I have a bunch of these together, that will help me get into this next skill.
Yeah. I mean, based on what you just said, we think sometimes about teaching some skills that then would enhance the teaching of other skills, or that you stack skills so that they are then integrated, as you were suggesting. But the misconception would be that sometimes some of those skills you teach first are prerequisites for the next, and that's not necessarily the case. But yeah, sometimes you teach some skills that in isolation are not functional, but then they will become functional once you put them all together. Exactly. Right? Like you could do some matching skills of identical objects, and then you can match, arbitrary matching of different things, an object to a picture or things like that. But in life, then there's a lot of go together matching that occurs. Like, for example, when you're doing laundry, when you are doing daily living skills, when you are participating in setting the table, when you're part of your family and you're part of your community, matching does occur. But then you want to be mindful that if you're going to teach some isolated forms of that skill, that then they are going to be used where it matters, right? When you set the table for your siblings and for your and for your parents.
Right.
That then it matters to have the skills and not something that doesn't, as we would say, generalize, right? And so again, being sensitive to the population I support, where they are more concrete learners, then instead of assuming that they will learn something in a very contrived situation and then generalize it where it matters, I just teach it where it matters because that's where you need it.
Exactly. Absolutely. Yeah, that's such a good point. So let's look at these different areas. So I put here communication and self-advocacy, right? So when it comes to communication, I know you kind of touched on these. So making requests. So these are different things that are important in order to enhance an individual's quality of life. So it's important for individuals to be able to make requests because that's going to allow them to access highly preferred activities or activities that they, that they prefer, they enjoy. And then also saying no, right? And having those boundaries. So that's part of communication as well. I always, every time when I do consultations, and I see my BCBAs and I see the programs, right? Most of them have this already, right? But there's always, some that are working on like BB map goals and verbal behavior goals and, making requests, managing, tacting. And I'm like, okay, so what are we teaching the individuals to say when they want to get away from an aversive stimuli, when they don't like something? And sometimes we miss that. And that is part of communication as well. When someone doesn't want to do something, they should be able to say, no, thank you. Or can I take 5 minutes off or get that away from me? Whatever it is that allows them to escape appropriately from those things that they find aversive, right? And then there's other parts and there's other types of communication as well. So there's vocal communication, there's verbal, and there's also those nonverbal communications, right? That it's important for them to understand. So what's your take on this part over here, Miguel, of the communication?
Yeah, I mean, I agree with you in the sense that this notion of being able to control stopping or alleviating things that are uncomfortable or aversive to you, that you don't like, that in some way are negatively affecting you, is important. And so when I said access to things that you love, as important is for you to be able to terminate or to stop the things you don't like that are happening to you. And yeah, you teach no before you teach yes, right? Because learning no keeps you safe. And we know that for a lot of these vulnerable populations, there's a lot of abuse, there's a lot of people taking advantage of you. And so if you want to teach to ascend to self-advocacy, you teach no before you teach yes. But just generally speaking, just maybe a little bit more technical to speak about this, but I would say teach to specificity. And not so that sometimes we just teach things that are too general and they limit communication. So teaching please or more to someone who doesn't have communication skills, if those are the first things you teach, if your audience, if those responding to you don't have enough cues or enough context, they won't be able to effectively respond to you. Okay, right. So if you teach eat, drink more, they're too broad. So you want to teach for the person to be able to specifically tell you what they want. Again, going to the idea of function, right? Of being a functional skill. When it comes to the path that people take to teach language when you're following a developmental curriculum, it becomes very soon about form and less about function, where if you're trying to approximate typical language, it matters how you construct sentences and grammar, syntax, all of that becomes relevant at some point. Right. Maybe too soon for some learners that are struggling to acquire just the minimal ways of communicating. So then function, if you want something to be functional, when you're teaching someone to request, if you're going to add effort, if you're going to add the length of what the person says, for example, with spoken word language, if you're going to give me 2 words, then it's because that's going to make what you get better, right? So now I want 2 of the same thing because I want more of it. I want two things combined because I like how they go combined. I
Right.
like something very specifically in with a feature in a certain way. So I want warm coffee,
Right.
or I want milk and cookie, right? So
Mhm.
then I would teach milk cookie because that's how you want it. And that's
Right.
how it makes sense for me to prompt you to say two words instead of one.
Right.
So it is always function over form. I'm going to
Mhm.
add effort as long as it makes the payoff bigger and better.
Right. Okay. I like that, function over form. And can you explain a little bit, because we don't, some of us are therapists here, but others are parents. So when you say form, right? Because I like that, function over form. So when you say form, what are you referring to?
It means what that looks like, what language looks like, and how it is typically structured, right? So instead of having you say, I want cookie and milk, please, Miguel, I would have you say cookie milk.
Right.
Okay. And so I don't need the entire phrase for me to know what you're asking me.
Right.
But the two words I need them. So
Right.
then I will then pick the thing that I need in order to respond effectively to your request.
Mhm.
And rather than having you approximate what someone typically would say when they have uh complex language.
Right. And it's also less of a response effort, right? If they're just saying, because a lot of the kiddos, they don't necessarily like speak because it's more difficult. It's more strenuous, right? For them to put out the words for that output. So saying this long sentence is not as reinforcing as just saying like two words that are it's going to get you the stuff you want immediately. So it's
Exactly.
less of that response effort.
Exactly. So we're sensitive to response effort. We're sensitive uh to the payoff relative to that effort.
Okay.
Okay, to the consequence, to the reinforcement that comes from you saying something shorter or longer, less concerned about how it looks like or how
Right.
typical. That's what I was referring to as more form over function. So we want function over form.
Gotcha. And then when it comes to self-advocacy, which has to also do with communication, and self-advocacy can be seen as speaking up for oneself, for one's interests. So this is very interrelated with making requests, with setting those boundaries, right? A lot of that. What's your take on self-advocacy, Miguel? I know it's pretty much
Yeah.
communication, but
Yeah, I mean it's one that perhaps it is overlooked in our programming, so we ought to be uh, sensitive to this and prioritize to teaching
Mhm.
self-advocacy actively, proactively. Um, and well, I mean, it's a tough balance sometimes when it comes to maybe the role of a parent or of a therapist when that learner is younger, perhaps, because there's more an authoritative parental kind of expectation or cultural expectations, and basically it's more about compliance, obedience, following instructions. So the behaviors that someone engages in as a listener, so not as a speaker. So sometimes it's about shifting those priorities a little bit about what the person needs to say as a speaker so that they have their own voice and then they have some of that control and are able to self-advocate. Now, it's a balance because I think in the other opposite side of this
Mhm.
can be creating a very prosthetic environment, a bubble in
Mhm.
which these people exist, and in at the end there's not enough skill building to life, so they then are ineffective just living life outside of those bubbles. And if
Mhm.
you truly want to help them thrive, some things they're going to have to tolerate the way we all tolerate them, right? Like waiting, accepting no, taking turns, sharing, transitioning, right? And so what a lot of people do then is the opposite. You guard them against anything uncomfortable or difficult, for the sake of keeping the peace, which that slide would then speak perfectly to that.
Yeah. And I think, again, we have to think about the long-term results, right? Or long-term goal. What is it that we are trying to achieve? And always also think about the child's safety, of course, being number one, but then what are we trying to achieve? Because, for example, I've had parents that I've worked with that bring in their child and they're like, well, he's his own person and I allow him to do whatever it is. And I'm not trying to be like a stickler and he doesn't have to follow all the rules. And then, when I ask about these dangerous situations, like grabbing your hand when you're going to cross the street, right? Taking medication, or when you say no to something that's hazardous, not doing it, don't touch this or whatever it is, those are situations where the child now does not follow through with what is being asked. And then they get into these dangerous situations. So it's important that the child understands. And the way that they understand is by us adults teaching them how these things work in the world, right? So there has to be some of this, like, I hate using compliance because I think it's been giving such a bad rep, but yeah, it's basically like some of this compliance training because they have to, they don't understand, right? Like what these hazards are out there.
Right. Yeah. When it comes to hazards and safety skills, when you have very early learners, then you just do it because they're not under vocal control. So sometimes you have to grab them by the hand and take them away from the street. Sometimes you have to do things to keep them safe as you're teaching those skills. But yeah, generally speaking, you want to also consider what are the things that they would need to tolerate in order to have a healthy life. And some of them, for example, could be routine dental and medical procedures. So you expose them to that. Now, when we teach tolerating skills, we can be really strategic about it and make it very gradual and systematic and setting them up to succeed. And some self-advocacy can be built into that. So it's not one or the other. They're not mutually exclusive. So our technologies of procedures, the ways that we shape skills are perfect for this. You just have to kind of be aware that you need to prioritize teaching this because you want families to be able to take them to the doctor, to go to the restaurant, to take them on a car safely, that they're going to tolerate the seatbelt. And so the more you avoid some of these circumstances, the more eggshells are going to appear. The things you don't do, the things you don't say, the places you don't go, out of fear of what might happen. So people then begin walking on eggshells. Again, this notion that you create a prosthetic environment, that you don't expose them to anything because it keeps the peace, but it is a short-term, perhaps, consideration that you could have. Since I have been working with individuals that have pretty severe behaviors, the notion of prevention and what they call antecedent manipulations, the non-exposure to certain things that can be triggering, have their role. They have a space there, but they're not meant to be there long term. You want to expose them and you want to kind of empower them, and the world opens up to them if you do. But it's being sensitive to the process as well as to the outcomes of your interventions.
Yeah, and this is no different than someone who has a phobia or someone who has social anxiety or any type of anxiety. The number one treatment for that is exposure therapy. So someone that has social anxiety and is truly crippling, right? Because let's say someone has social anxiety and they never have to leave their house and they're happy. That's fine. But let's say someone has social anxiety and they want to get married, they want to relate to others, and it's really crippling and they can't do it. So what you would do is not allow them to just stay home forever and ever and ever, because they're not going to really have a good quality of life that way. but you want to expose them. And when I say exposure, it's that progressive exposure. We're not doing flooding where you're just throwing them there in a, I don't know, in Dolphin Mall with all the people running around. We're not doing that, right? We're progressively doing it little by little, and we're teaching them skills to cope with those situations, so they kind of get used to it. That's the whole concept. They get used to it, and they stop having these physiological reactions to these situations that they find aversive. So that's really what tolerating these things are.
Sure. Yeah. And one thing, as we have been talking a lot about the individual, right? So at the individual level, and that's how we have been trained to look at things. We individualize. And sure, we ought to do that. I'm not saying we shouldn't, but we should look at the entire system, the entire ecology, that all the stakeholders, they matter. Parents, what they want, it matters. Or the staff. So when we're thinking about preferences and when we're thinking about quality of life and things like that, then you consider everyone involved, and sometimes you can zoom out completely to a cultural level. So if I'm in Italy and I'm teaching a group of adults, I want to teach them to be able to go to have coffee, right? And a gelato, with your group, and stay safe while you're doing it, and being able to tolerate aspects of waiting in line, and basically just kind of having some of the things that would be required of you in those circumstances, so that you can enjoy and be part of that activity. If you are in Oregon, and in that culture, people love to garden, then you teach gardening skills to the learner. That person, that child, adolescent, may have never showed any interest in gardening, but it can be something you tolerate at first and something you're neutral about, or you don't really gravitate towards, but then it becomes something that you become fluent doing, and that it's part of something you do with the people that you love, and that gives it meaning. Now, once you become fluent through practice, through shaping, then it becomes then something you love, and something you enjoy, and something you gravitate towards, that you initiate doing those kinds of things. So something that you didn't care about, that you just tolerated, then becomes your preferred leisure skill. So then we ought to consider also exposing. It's just not to make their lives better, but to make everyone's life better, the life of the family, and consider the siblings. And now the parents can go out with you, and they can include you in the things that they love, not only what you love. And so that's important, because this notion of individualizing has moved away from being sensitive to
Culture.
culture, family, all the people that are important to you.
Yeah, and I think there's a big like cultural thing to it, right? Like I come from a Hispanic, I mean, I'm Hispanic and I come from a Hispanic family. I know you do too. So, it does allow you to share those moments with your family members, to gain more of those reinforcers, and even to make friends, right? Like in that same culture, you're doing the same things that they're doing, so you're more likely to bond over that thing you guys are doing together. In other words, right? So it allows you to form those relationships.
Exactly. And doing things, being competent, doing something fluent, and leads to being confident. It leads to you doing the thing because you know how to do it, know what to expect. It feels good to do it. It's a good feeling to know how to do something. You end up doing more of that. So, but yeah, in terms of how that brings you closer to others, that's a big motivator. I can do that with you, and that's what makes it more rewarding to me. It's not something I initiated or that I cared about initially, but it became something I care about because of you, my friend, my peer, my sibling, or my parent.
Yeah, definitely. And waiting is one of these skills that it's here. And I know that this is something that we use a lot in our behavior programs. As behavior analysts, we use, waiting, rating. And I remember there was a parent that once told me, she said, I don't understand why you guys are working so much on waiting when nowadays people don't wait, right? Like people are just impatient. And I said, yeah, but for the most part, people don't have outbursts because they can't wait, or they don't engage in these problematic behaviors because they can't wait, right? So one thing is feeling impatient and sort of like keeping it in. And another thing is acting on it, which is, I think, where the problem is created.
Yeah, yeah, certainly. And so it's a balance, right? It's management while we intervene, is gradual exposure. But again, if we go back to the beginnings of the conversation, we were thinking about when we're teaching something, why are we teaching it? What is it that we're teaching? Do we need to rethink what it is that we're teaching? And another thing is, when you're teaching an early learner, just think about what this learner will become an adult someday. So you want to think about the future and think about what they're going to need in the long term. And so it, a lot of it, without being too redundant, it's about teaching the things that will make your life better, that will make you more independent, more autonomous, happier. So that's what it is all about. And sometimes then you reconsider subtle but important things about what to teach, or the context in which you're teaching. When are you teaching something relative to another thing, right? And just always rethinking and pausing to think about where things go, where skills go. Accommodations don't go with you, skills do.
Yeah.
So you wanna be sensitive really to that.
Right. So the other thing here I put is following directions. So that kind of, I know we've touched upon it, but really completing acquired task in new settings. So this is a big pet peeve of mine when I see that some behavior analysts, like, they master plan. I mean, they master they master tasks, and then, or responses. And then when I ask them, well, have you at least contacted 3 different settings or 3 different people? The answer is no. So I'm like, how do you know that the individual actually mastered it if they're only doing it with you sitting down in the room? Like, how do we know that they mastered it? So what's your take on this generalization that I know we talk about a lot, but I feel like we don't do enough of?
Well, again, as I was saying at the beginning, you should from the beginning consider teaching in the context where those skills would be expected to occur. And that means, well, by saying context, is the people that you would commonly come in contact with, different settings, the ways in which people would approach you and interact with you. Those are the ways that you would be practicing.
Miguel, can you give us some examples of that?
Sure. So for example, if I'm teaching back to communication and requesting, I want to teach, for example, we start with the things that are highly preferred, right? A way to know that this person is able to communicate effectively and independently, for you to say, okay, this we met this goal, is not only to consider that out of 8 of 10 opportunities they did it correctly, right? But is that they do it consistently and fluently. Fluently means that you do it without hesitation in a matter of seconds. Okay, so one aspect that I would consider is fluency. The other is the generalization that you are alluding to, where I would want it to occur with variations of the different ways that the opportunity would present itself with different people in different settings. If I start probing it, and now I take you to the mall and I take you to the store, and I have your grandfather and not your mom be the person who's practicing with you, and you are able to communicate, to request the things you want with all of those different audiences, with all of those variations, without hesitation, in a matter of seconds, consistently, then I say it's fluent and it has been generalized. And in that way, it will continue to occur, because what happens is that when we don't teach to fluency and we don't program that intentionally for generalization, other settings, other people with less motivation, with more motivation, with variations of that, then those skills, they fade.
Yeah.
you move on to the next therapist, to the next RBT, to the next, you move to a different location or to a different educational program, and things are gone. That way, all of this effort faded. So how do we try to solve for that? Is by teaching to fluency, teaching in the context where the skill would be expected from the beginning, and just truly making sure that the skill is fluent before we are able to then say what they were stating to you, which is that, okay, we mastered this. And percentages sometimes are deceiving in that way, right?
Yeah, they are.
Because you don't get a true sense of the skill the first time the opportunity was there. So some ways that, for example, we would suggest you would test or probe a skill is doing what they call a cold probe, or what they call a first opportunity of the day probe. So you just want the most important opportunity is the first opportunity. The rest, if you do practice, then you are kind of now is distorted because there are practice effects. So if you try different trials, then it's not the same as that first opportunity and how it would occur in real life.
Exactly. Absolutely. Yeah. This reminds me of when we were teaching my little one English, because she only speaks Spanish. So my son was like, hi, and she was like, hello. And then, I had someone else come in, and he was like, hey, what's up? And she was like, color blue. So obviously she didn't like generalize this response. She only responds hello to when you say hi. But when you change it up for her a little bit, she just says something random, right? So this is like, I think, a perfect example of that, that variety in the way that they're responding. And that proves really, okay, they've mastered the skill.
Precisely. Exactly. Yeah. Perfect example. And again, like it's about really considering these things as you're programming.
Exactly.
And in that way, you're in the right track, right? A lot of it is about what you're teaching and where you think it is going or where you want it to go.
Right. Okay. I'll let you use that example for your webinars. You just have to like quote my name when you do.
Okay. I will.
All right. So if you guys have any questions, please, everyone is like very, very quiet. Actually, there's a question here that I missed. Okay. Okay. You guys are making me run for my money. So how can you convince a parent that has homeschooled her kid with autism all his life to have him exposed to jobs, dating? Now as an adult, they expect the individual to have these interpersonal skills when parents have shielded him from the world and refused to have him exposed to other kids with autism and more typical individuals in hopes that he models more appropriate behaviors. I see that happen a lot. The kiddo is high functioning, but unable to advocate for himself to pick what he wants to do, nor does he have the motivation to know what else the world has to offer in order to make decisions for his preferred activity. So the initial question is, how do you convince a parent that has homeschooled this child? So, I mean, it's hard to convince a parent, but there are, I guess, different things that we can bring to their attention. So what are some things, Miguel, that you think would be important to speak about here?
I mean, I could give you a few suggestions, but we're speaking here with the motivational interviewing guru. So
Thank you.
you should be the one. I defer to you for this answer.
Yeah, I mean, it's, I think coming up with the information in a way that doesn't, because imagine if we tell the parent all of this, right? The parent is just going to feel shame and it's going to feel guilt. Like they cannot go back in time and kind of like, work on these skills that weren't worked on. But I think sitting with this parent and revising the current plan, and as Miguel mentioned, looking at those long-term goals, right? So 5 years from now, mom, what do you expect your child to be doing? How about 10 years from now? Where do you see him? right? I think those are very important questions because it opens up your eyes and you're not just here. You're thinking beyond that. You're thinking in the future. And then once they're able to identify what that is, and of course we have to take, what the child wants to do as well into that consideration, then kind of work backwards. So what are some skills that he needs to build right now so we're able to get here? And then focus on those skills. These are things that everyone knows, but I think we have to kind of evoke it from them. We have to bring it up so that they understand. And then the thing here with, because I see this a lot with like social skills. So we have like an early intervention program in our office, and they're not typically developing kids, right? They're kids that carry a diagnosis. And a lot of the parents say, well, why don't you have like a model child, or why don't you have someone that they can imitate and things like that? And I mean, I don't see the necessity sometimes in that. But what do you think? Because this is very similar to what is going on with this person, where this person's client, I guess the parent wants them to be with other adults that have appropriate behaviors. So what do you think about that, Miguel?
Well, I mean, what I thought with the question is that while I don't have an exact script or what you would say, or a generic, rule of thumb for this, all I would start with in thinking about values is do it non-judgmentally. And so one of the issues that we have sometimes as professionals is that we jump in with judgment and too quickly before building a relationship of rapport and trust with the parents. And one person that always comes to mind that has been very influential for me, his name is Patrick Fryman, Dr. Patrick Fryman. He talks about the circumstances view, which is not the most common way in which we engage in this kind of professional relationships. And ironically, because behavior analysts are taught this circumstances view to explain behavior, the idea that the behavior is a function of its circumstances. So if we apply this not only to the children and the people in vulnerable populations that we serve, but with their families, including their parents, then we would then have a more compassionate view on why they do what they do. So essentially, we know that then this mother or this father, in some way, their circumstances shaped those behaviors. And if we apply that same understanding, then we arrive to then a more compassionate way to have those conversations with them, a less imposing way to do it. And then those conversations are fruitful. You just get to a point where you have conversations frequently. You come back to them. You do a lot of demonstrating, a lot of simply arriving to those things, evoking those things as you were suggesting. It's about them arriving to those things themselves, and not for us to preach,
Right.
To prosecute or politic to get them
Exactly. Absolutely. And I kind of see some frustration from this message, and it happens because this is something that's called the writing reflex, right? Like, we know what needs to be done. We have the knowledge. We go to these webinars. We do these talks. So we get frustrated as therapists because we see the light in the back of the tunnel, and we see how to get there. But at the same time, it is not about us. It's not about what we want. It is about the parent and what they're able to do and what they want to do. So at the end, we have to respect that autonomy. And I think in doing that, it allows us to not feel as frustrated, because here we are, we're going to walk with you. We're going to, collaborate with you. We're going to partner with you, but it's up to you whether you're going to do it or not. And that's where we kind of tap out, in other words. So I think that that's a lesson for us therapists to keep in mind, because that prevents us from getting into burnouts that we see so often, because we wanted more than the parents do. And it can be like that. We can want it more, But at the end of the day, we have to understand that it's really up to them. We have to leave that decision up to them.
Yep.
So we're already at the end of our presentation. Any questions you guys have, please put it in the chat. Thank you so much for that question. That was great. And we spoke about a lot. I think we touched on a couple of things, and we have a couple of minutes left. So Miguel, do you want to tell us a little bit about the workshop you're doing, to see if anyone is interested in attending?
Sure. Yeah, so on June 24th, I'm going to be conducting a 6-hour workshop in Miami, in Palmetto Bay, at a foundation called the Rising Start Foundation. And this workshop is about this curriculum I mentioned in the intro. It's called Essential for Living. It is a life skills, a functional skills curriculum for children and adults with moderate to severe disabilities, with limited skill repertoires, with that point of reference to quality of life. It was written by a couple of behavior analysts, Dr. Patrick McGreevy and Troy Fry. Patrick having 50 years of experience working in behavior analysis and education for those populations, and Troy over 30 years. Really rich, extensive knowledge. The manual has been around for 10 years. They took 8 years to develop it. Really a thoughtful process to providing a curriculum guide for this population. And so I teach people on how to get started. It's an introductory workshop. So I kind of really go in depth as to what the approach is and some of our assessment and curricular procedures, how we track progress, our teaching protocols, the ways in which we help people select and confirm an effective method of speaking that will last a lifetime, and just teaching to many domains of functional life skills that are important in someone's life, beginning with what we call the essential 8 skills. We call them must-have skills, and those are the ones that are very impactful when it comes to improving quality of life, independence, and helping you be free of some of those forms of maladaptive behavior. So yeah, if you have any questions, I guess I could put my email in the chat. Maybe it would be the easiest. But if you go to efltraining.com, efltraining.com, and you go to live events, you would see the workshop there. And again, it's June 24th in Miami. The curriculum, the book is included with registration, as well as CEUs for behavior analysts. So you would get 6 CEUs other than the workshop and also the book.
Okay, perfect.
Yeah. Mm-hmm.
Well, thank you so much, Miguel. Thank you again for doing this. I will definitely see you around. Thank you all for coming. Thank you all for attending tonight. And I'll see you guys next month on our next webinar.
Thank you, Monica. Thank you so much for the invitation. It was a pleasure having this conversation with you.
All right. Bye, everyone. Have a good night.
Hey.
Bye, everyone. Have a good night.